going to get started. Can I welcome everybody to tonight's meeting? And the meeting is about vaccine hesitancy. If there are any questions that people have that they need answering, this is the platform that you use for those questions. So what I'm going to do, I'm Paulette Hamilton. I'm the Cabinet Member for Adult Social Care and Health. And I'm going to ask the interpreters to please put their camera on and introduce themselves, which is Stephanie and Rachel. Stephanie?
Hello, Stephanie Raper, British Sign Language interpreter. I'll be starting off tonight.
And Rachel?
Hi, my name's Rachel Beasy. I'm interpreter from Birmingham, and I'll be second.
Right. Can I ask all those who are on this meeting tonight, if you're not speaking, or can you please turn your cameras off and mute out, just for the bandwidth. We don't want to lose anybody as we're going along. Also, if you need the people that are doing the sign language, please press the pin so that you can use them on the call. If I've got that wrong, Gemma, when she introduces herself, can you explain that a little bit more clearer than I think I have a minute ago? So let's move swiftly on to, where is she? Gemma. Gemma, can you introduce yourself, please?
Of course. Good evening, everyone. I'm Gemma Rower. I'm the Assistant Director of Communications for Birmingham and Solihull Clinical Commissioning Group. Regarding the interpreters, you can just simply pin them to your screen. Alternatively, if you're having any problems, please private chat them using the Zoom function on the right-hand side of your screen. Thanks very much. Fantastic,
Gemma. And Gemma will also be forwarding the questions later on. We make a good double act. You'll see as we go along this evening. Can I start with Dr. Peter Ingham? Can you introduce yourself, please, Peter?
Yes, good evening, everyone. My name's Peter Ingham. I've been a GP in Sutton Coldfield for 30 years now. I've recently stepped down as the chair of BSOL CCG, where I worked alongside Dr. Riz Aladina. And I also stepped down from my role as Vice Chair of Birmingham and Birmingham Health and Wellbeing Board, where I worked alongside Councillor Hamilton and Dr. Justin Varney. And I'm now working at UHB on the vaccination programme alongside Clara Day.
Fantastic. And Gemma has just reminded me, if you've got any questions, please put them in the chat box. If you're unable to write in the chat box, I will take a couple of questions at the end if you put use the and function and put your hands up. Can I please ask people, do not try to come on the call and talk about their disbelief in COVID, because we will cut you off. I'm not messing about, we will cut you off. This is too important. Thank you very much. Can we move straight over to Dr. Day, please?
Hello, I'm Clara Day. I'm a kidney doctor at the Queen Elizabeth Hospital, but I've been working on this COVID vaccine programme as one of the medical leads for it, setting it up and trying to keep it running across the whole of Birmingham and Solihull. Nice to be here tonight.
Thank you very much, Dr. Day. Can we move straight over to Dr. Raz, please?
Hi, my name is Dr. Rizwan Aldina. I'm one of the GPs in Stetchford in Birmingham, in east of Birmingham. And I'm also one of the governing body members of the Birmingham Solihull CCG. And I'm here to represent the CCG to talk about the east of Birmingham and the vaccination uptake and how we're getting on. Just as a quick piece of good news, we have, as of the 7th of February, we have managed to vaccinate over 211,000 people in our city so far. So that is extremely good news. We have a range of vaccination sites available at the Millennium Point, at various GP practices, at least 4 around east of Birmingham, but 32 in total across the city, at the hospitals at Heartlands, QE, Good Hope, and at various pharmacy sites around the city. And we are also working with practices in East and Central Birmingham to see how we can support them to bring up the uptake of the COVID vaccines. And I would like to think that Birmingham is quite a diverse population, but the CCG is leading in the inequality issues and addressing them so far. Thank you.
Thank you for that, Dr. Raz. Now we're going to move straight on to Dr. Justin Barney. Dr. Justin Barney is from Public Health, and he will be introducing himself, but also putting in context where we are at the moment with vaccines. Dr. Barney, over to you.
Thank you, Councillor Hamilton. So I'm Dr. Justin Barney, I'm the Director of Public Health for Birmingham City Council. And I'm going to take you through a couple of short slides to just set some context for the discussion today. So Gemma, are we able to show those? Thank you. So first of all, I thought I'd start by just giving a baseline about what is COVID and what is the coronavirus, so that we're all on the same page for the discussions. So COVID-19 is caused by a newly version of the coronavirus, which was found back in December 2019. The symptoms are a high fever, a dry cough, or the loss of sense of taste or smell. And that is true for all of the types of coronavirus, the new variants as well. They're still the same symptoms. People have other symptoms, but those three are usually, at least one of them is there. Of those who catch coronavirus, most people recover without having to go to hospital, but about 15% become seriously ill and 5% become critically ill. The virus is spread through the droplets of saliva that come from our mouth or from our nose when we cough or sneeze or shout or sing. And the virus gets into our body because we touch something that has those droplets on them and touch our face, or because those droplets land directly on our eyes, in our mouth, or in our nose. The virus can't burrow through our skin and it can't climb mountains, so it has to get on your face to be able to get into your body. And that's why we stop the virus spreading by washing our hands regularly, keeping the physical distance of 2 meters, or wearing a face covering that keeps those droplets close to our face if we're infectious. If we go on to the next slide, please, Gemma. So now I'll just talk briefly about testing. There are 2 different ways of finding out if you have coronavirus. The first is through a PCR test, and this is where you have a swab to the back of your nose or your throat that is sent to the lab to be investigated. And that's a very good test at finding very small amounts of the virus. But because it's a lab test, it takes several days to get a result. So we use it for people who've got symptoms. And you can book a test through the NHS website. And we have 12 testing sites across the city. The newer test is the rapid test, which is called lateral flow. It's the same swab to the back of your nose and the back of your throat. But instead of going to the lab, it's used with a little kit in front of you, and that gives a result in about 30 minutes. Now, because it doesn't go to the lab, it needs a lot of the virus on the swab to be able to find it. So we use this test to find out if people are infectious, especially if they don't have symptoms. And you can get a lateral flow test at a range of sites across the city, and we have walk-in centres as well as booked appointments, and that information is on the council website. If we move on to the next slide. So firstly, when we talk about vaccines, it's important to put this in the context of how our body defends itself. So our biggest defense against infection is our skin and our stomach. Think of them like the walls of the castle. And then we have the added barrier of our stomach acid and our saliva. And all of those things stop infections getting into our body. We then have a general immune response, which attacks any foreign particles and any foreign organisms. And then we have a special attack force, which are antibodies, and they fight off infections who've attacked us before. So it's our learnt immunity. Vaccination is about teaching our body to develop those special forces and develop antibodies to a specific disease. And the antibodies attack a specific bit of the organism's outer coat, so often called a protein spike. Think of it a bit like buttons on a jacket. Our body sees those buttons, knows it's foreign, and attacks any coat that's got those buttons on it. There are different ways that vaccines work. Some use a dead virus to show us what these buttons look like. Some attach the buttons to another harmless virus to introduce them to our body. Some use the instructions from the virus on how to make the buttons and inject that into a small number of our cells, so we produce buttons and our body recognizes them and creates antibodies. But we don't introduce enough of the instructions to create a whole virus. So vaccines teach our body to recognize that the bit of the virus's coat, and to attack it. But it doesn't give us the virus, and it doesn't teach us to make the virus. And vaccines are very safe and are used across the world every day. We move on to the next slide, please, Gemma. The way that vaccines are developed is very standardized across the whole world. And COVID vaccines followed this same process. We test the vaccine first in a lab to see whether it works in a Petri dish or in a test tube. Then we test it in humans in 3 stages of clinical trials to check that it's safe, to check that it does what we think it's going to do, and to check that it works in different types of people when we give it to larger numbers of people. And when those trials have been completed, all of the evidence is given to an external and independent regulator who says whether the vaccine is approved. In normal times, this takes about a year to a year and a half because committees must meet, researchers need money, and they need to recruit people to do trials. But in COVID times, there was money available, there were lots of people who wanted to do the trials, and when the committees needed to meet, they met when they were asked, rather than saying, I'm sorry, I don't have a meeting till 3 months' time, you have to wait. And that's why the development was faster, but it followed all the steps and all the safety monitoring to ensure the vaccines were safe. If we move on to the next
switch
slide,
interpreters,
please,
thank you.
There are 3 types of COVID vaccine that have been approved so far. 2 of them, the Pfizer and the Moderna vaccine, work in the same way, in that the vaccine introduces a bit of the virus's genetic code to teach our body to make the protein spikes. So the instructions to make the buttons. the AstraZeneca vaccine works in a slightly different way, in that it uses a harmless animal virus that doesn't make humans sick to introduce the instructions to make the spike protein. Once the body reads these instructions, it makes the spike protein that our body then responds to and creates antibodies. These are one-time instructions, so the body doesn't continue to make spike protein. It forgets after a while. The vaccines are given as 2 doses, because think of it like taking your GCSEs and your A-levels. Your first exam teaches you to be competent, but the second exam teaches you to be expert. We know from the research that after the first dose of the vaccine, your chances of dying or ending up in hospital are massively reduced. But you could still catch coronavirus. After the second dose of vaccine, you have more protection against infection, and that is why you need both doses of the vaccine. We know that the vaccines are effective, but they do take time for the effect to kick in. So it will take several weeks after the first dose to be protected from dying or ending up in hospital, and several weeks after the second dose to be protected. And that's why it's important we keep going with hands, face, and space. None of the vaccines contain any animal products or fecal products. We go on to the next slide, please.
Justin, are we nearly finished? Because we've got quite a lot of questions. Thanks.
2 more slides, I think. So the side effects for vaccines are common. So most people will get a sore arm where the needle went in, and for maybe a day or 2 afterwards, will feel a bit headachy or a bit sick, but those will go away. It is very unusual to see a serious and severe reaction to these vaccines. And as Rizwan said, hundreds of thousands of people have now had them in Birmingham, as well as millions across the country. As with all medicines, if you've had a previous severe allergic reaction to a medicine or a vaccination, you should tell your doctor before you have the vaccine. There are some allergic reactions where the Pfizer vaccine is not recommended, but the Oxford vaccine can be given instead. The vaccines are safe for pregnant women, but at the moment, we are advising pregnant women to talk to their midwife before they have the vaccine. If we go on to the final slide. So you will have seen in the news that there are new variants of the virus, and the virus changes over time, and that is normal. Sometimes the changes make the virus more infectious or more deadly, or make the vaccine less effective, or a combination of these. Currently, there are variants of concern in South Africa, the UK, Brazil, and Japan. When we find new variants, we do extra trials to see if the vaccine still works. So far, the trials suggest that the vaccines are still very effective at stopping you dying or ending up in hospital with COVID, and they still stop a lot of infection, but it is not as good as against the old variant. Now we know how to make a vaccine for coronavirus. It's faster to make a booster injection that would cover new variants. But at the moment, you should take the vaccine we have now, because the dominant strain, the most common form of the virus, is the UK variant, and the vaccines are very effective against it. That doesn't mean we might not need a booster in the autumn, but we can worry about that in the autumn. And the important thing is to get the protection now. Thank you, Councillor Hamilton.
Fantastic, Justin. I think you've answered an awful lot of questions within that presentation, but I'm going to go straight over to Gemma, because what we want to do is to absolutely and utterly go into questions, because that's why people are here tonight. Gemma, can you start with the first question, please? We're doing them in blocks of 3, and I will pick who answers them.
Right, okay, Paulette, thank you. So the first one's from Tarek. He wants to know if there's any vaccination sites required in Alum Rock. He would be interested in helping to set the targets, as he feels that BAME community take-up is low, and there aren't very many appointments. So some comments around that one.
Can I ask Dr. Raz to answer that question, please?
Thank you, Councillor Hamilton.
No, I don't want you to answer it yet. We're going to call out, just write it down. The
Sure.
second question, can you now give that second question, please, Gemma?
Of course. This one's from Val. She wants to know if you are asymptomatic with COVID, how long are you contagious for?
Right, that question is for Dr. Ingham.
Great. And the next one is from Councillor Mahmood. He said 211,000 vaccinated in Birmingham. That's nearly 20% of the population. So more of a comment than a question.
Yeah. So someone can bring that in with what they're talking about. Up to the next question, please. I won't give that one. I want Justin to talk about that one a little bit.
Another one from Tarek. He wants to know how we can have more community engagement in Alum Rock.
Dr. Day, are you able to answer that one?
I think that's probably in Riz's sphere as well, because I know that he's working hard on this.
Okay, well, we'll give that question to Riz also. So Riz, over to you. You've got question 1 and question 4.
Thank you very much, Councillor. I'm going to probably amalgamate both the questions because they're specific for Alum Rock, and I am the locality lead for East Birmingham, so it falls under my jurisdiction per se as such. So yes, there is a little bit of a low uptake in Alum Rock, and we expected that. Ethnic minorities nationally have been taking up the vaccine much less than other sort of groupings would do. And it is not for the lack of trying that this is the case, unfortunately. So I have been working closely at hand with the GPs and the GP surgeries in Alum Rock and Washwood Heath, because it's a similar population. And they have been trying their utmost best to get in touch with all the patients within the JCVI cohorts up to the age of 70. They have been running clinics on the weekends. They have been running clinics in the evenings. They have been doing home visits for various families who perhaps cannot get to the surgeries, but there seems to be quite a bit of hesitancy around the vaccine uptake. And there are particularly 2 or 3 issues that we are finding which are in common. The first thing is a number of elderly patients are actually abroad. They are not in the UK because they usually winter in Pakistan and in the Asian subcontinent. So unfortunately, getting through to them is quite difficult. The second thing is that a lot of the older patients' healthcare needs are taken up or looked after by the younger generation. Now, if the younger generation are hesitant about the vaccine, it actually makes them less likely to have their parents or grandparents take up the vaccination. And our GPs are working extremely hard in order to combat all the misinformation that is being given out by the social media in this respect. In terms of how we can improve uptakes, I think the Birmingham Solihull CCG has been in the forefront in discussing this issue with the masjids group, with the churches, and various other community leaders and faith leaders. And I myself sit in the masjid group, which meets every fortnight on a Monday to see how we can improve uptake. I've also been on various different engagements in terms of local radio, for instance, Radio Aapki Awaaz in Washwood Heath, which we have had an hour-long discussion around vaccine uptake, and various other media outlets as well. What we now need is the cooperation of the residents. A lot of people are saying, well, we'll take it in 2 weeks. We'll see how other people react to the vaccine. Well, 211,000 people have taken the vaccine and they've all been fine. We haven't had an anaphylactic reaction or an adverse reaction so far within our local patch. So hopefully that should be something that we work with. We welcome all the help that we can get, and perhaps we can pick up offline with Brother Tariq Iqbal to see how he can help with the vaccine uptake. And the last thing to say that, yes, there has been a lot of enthusiasm from the community and from masjids and from various community centers, but unfortunately we can't say yes to everyone. We are working through selectively, going through the merits of each of the sites, and we will be in touch if we feel that this is something that's going to help. Thank you.
Thank you, Dr. Ra. Move straight on to Dr. Ingham. Question 2.
Yes. We would regard you as an asymptomatic individual as infectious for 10 days. Clearly, they won't know exactly when they contracted COVID, but you take that from the date of the test. And I think that's the simple, straightforward answer to the question.
That's fantastic, Peter. Thank you, Dr. Ingham. Justin, do you want to make a comment? The one that regarding what Councillor Mahmood said. He said 211,000 people have been vaccinated in Birmingham, and nearly that is 20% of the population. I would say that's quite a positive thing. But can I ask you to just make a quick comment about that?
Yes, absolutely. It is good news. But that 20% is not evenly distributed across the city, and that's the key point. And one of the reasons we're doing sessions like this and all the work that Dr. Rizwan talked about is about ensuring that we do get a much more even uptake, particularly in our more deprived communities and many of our ethnic communities who are not taking up quite as strongly. So it's a good start, but we need everyone to take up the opportunity.
Fantastic, Justin. Gemma, could we have let's have 4 questions because we've got 4 members of the panel. So Gemma, over to you.
Thank you, Paulette. So Mohammed would like to know if we've had any Kent variant cases in Birmingham. The next one is from...
Hang on, the Kent variant cases. Can Justin answer that, please?
The next question is from Nazma. If someone's got a weak immune system and has an allergic reaction with lots of foods and any medicine, is the vaccine safe for them or not?
That's one for Clara. Clara? Yeah, about allergies? That's quite a common question. Thank you.
Okay, the next one's from Derek. Derek would like to know if alcohol is used in any of the vaccines, please.
Again, a very common question. Dr. Ingham, please.
And the 4th question from Leslie. They would like to know when 65 to 70-year-olds will be vaccinated. Thank you.
Dr. Riz, I want to give you that question, but if you're a little bit unsure, I know Justin knows that also. So let me start with Justin, relating to the Kent variant, Justin.
Yeah, so at the moment it's about 83% of all new cases in Birmingham are the new Kent variant. But the vaccine works against the new Kent variant, so please get on and take it.
Brilliant. Dr. Day, allergies, just to cut it down to one word.
So I think there were 2 parts. One is a weakened immune system and the other bit was about allergies. So if I do the first bit first, so if your immune system is weakened, either because of a condition that you have or because of medication that you take, then you are obviously more likely to get poorly with infections. And so therefore it's particularly important that you take the vaccine. So we would encourage you to do that and to help your immune system to fight back against the infections. It depends how weak your immune system is as to how well you respond to vaccines, but we would certainly suggest that people with a weakened immune system have the vaccine, and most people will respond well to it. The allergy question is something we get a lot of, and obviously there was a lot of talk about allergies with this, particularly the Pfizer vaccine when it first came out. And there's now much more experience about it, and we've actually had 243,000 people vaccinated in Birmingham now, so it goes up every day. And as Riz says, actually the number of allergic reactions we see, and I see all of those that happen, is very, very few. But what we are saying is that if the Pfizer vaccine, now we say that if you carry an EpiPen and you know what you're allergic to, so if you're allergic to bee stings or peanuts or a particular drug, then actually that's fine. The vaccine will be fine for you because you know that you're allergic to that. There are some particular medications that if you are allergic to them, that you shouldn't have it, but those are very, very small, and you should discuss that with your doctor when you go to have the vaccine. And so very occasionally, we would suggest that you have the AstraZeneca vaccine as opposed to the Pfizer vaccine. But most of the time now, we are very happy with people with allergies having the Pfizer vaccine. So I hope that that helps to explain a little bit around that.
That was well done. That was perfectly done. Dr. Ingham, Peter, your question?
It's simply whether there is alcohol in the vaccine. I believe there is a very, very small amount of alcohol in the AstraZeneca vaccine, but it's an absolutely minuscule amount. I'm not sure whether the same actually applies to the Pfizer vaccine. I think it might be, but it's a tiny, tiny amount.
Right. Thank you for that. And Dr. Raz or Rez?
Rez, yeah. So thank you. Yeah. So the 65 to 70-year-olds, I think you will find that a lot of the surgery and PCN sites have already started, or if not, are starting by next week to be doing the 65 to 70-year-olds and those with chronic ailments. So your wait is almost over, and hopefully we can get you done as soon as possible.
Thank you for that. Can we move straight on to Gemma? Gemma, can we have 4 more questions, please?
Yeah, of course. So Glenn would like to know, he had his first dose of the vaccination, but 5 days later he got a positive test. Does it mean he has to start over again? Tarek.
Hang on a minute. Can Peter answer that question, please? Dr. Ingham, question 2, please, Gemma.
So Tarek's made some more comments regarding why aren't there any appointments and why is there a shortage of vaccinations in Birmingham? So that's the next question or comment.
Dr. Day, would you mind answering that question, please?
Beatrice would like to know how we can engage and collaborate with different organisations about the COVID vaccination programme.
Dr. Varney, can you answer that question, please?
Yeah.
And the 4th?
And the 4th one's from Derek again. He understands that the vaccinations have stopped at Heartlands Hospital. Why is this, and when will it resume there?
Right, Dr. Riz. Can I ask Dr. Riz to answer that 4th question first, please?
I think if you don't mind, would I pass it on to Clara, because she's working at the Heartland site. I can take Clara's question instead.
Okay, well, if you take Clara's question, and then I'll take Dr. Day in next, because I am interested in that one. Carry on. Go on then, Dr. Riz.
So Clara's question was, just remind me, I think it was to do with what, sorry,
I've lost my train.
Sorry about that.
Gemma, what was Clara's question? She had question 2 of 4.
bear with me. Oh gosh.
I remember what it was. It was.
What was it? Go on.
It was why are they struggling to get an appointment
Yeah.
for vaccination, and is there enough vaccine in Birmingham?
Shortage
And
in
why
appointments.
was late in starting? Yes.
Right.
So I can answer that question quite confidently because we were involved in a lot of the setups within East of Birmingham. Yes, the vaccination started later in East Birmingham compared to the rest of the city, but that was because at that time the predominant vaccines which were available were the Pfizer vaccines, and the logistics of those Pfizer vaccines are quite specific. That you get 195 vials, which all have 5 doses each. So you have to have a population size in your priority group where you can complete the vaccine, because you only have 3 days once the vaccine is thawed out for the vaccine to be used up. And unfortunately, our elderly population in East Birmingham is smaller than some other parts of the city. We are quite a young population in that respect. So therefore, it was thought that it would be better to start in other parts of the city and then come to us when either the AstraZeneca vaccines were available, or we could then mix cohorts for over 80s and then over 75s to get the sufficient numbers. There is no lack of vaccination appointments within East Birmingham. I can assure you that because I've had a discussion with all my GP surgeries, and they are more than happy to vaccinate as people become available. But unfortunately, we have to go by the cohort groups within cohort 1 and 4. But if you change your mind, if you are ready for the vaccine, just get in touch with your GP practice and they will sort the appointments out for you. Like I said, there are various different sites where we can get you vaccinated. It can be done at the PCN site, it can be done by some of the pharmacies, and it can also be done at the Millennium Point and various other places. So there is no shortage of appointments at all.
Right, can we go straight to Dr. Day about, they're specifically asking about Heartlands?
Yeah, I just wonder, Paulette, is whether it'd be helpful for us to remind people about the cohorts that people allowed, the groups of vaccines that we're moving through, because we've talked several times about the fact that when it becomes your turn, and what the government and the scientists have done is grouped people into those that they feel are at most risk to vaccinate first, and then we're working through the population. And this may feel why you're not getting vaccines and why there's no appointments. And the first group we did was people who live in care homes and care home workers, because we know how badly they've been affected during this time. The next group was people over 80 and all health and social care workers, because again, people over 80 have been really badly affected, and our healthcare workers, unfortunately, are very heavily exposed to the virus, and we need to protect them to keep the health service going and to protect them in their jobs. Then it becomes going down in age order. So then we went to 75 to 79 and then 70 to 74. And just this week, we're now going into 65 to 70 in Birmingham. And we're also going into, over the next few days, the people who fall into what we call a clinically, so before I say that, before we did the 65s to 70s, we did a group called clinically extremely vulnerable. Justin's laughing at me now. So clinically extremely vulnerable are a particular group of people, whatever age they were, who had conditions that made them really likely to be affected. So dialysis patients, transplant patients, people who are currently having chemotherapy, people with sickle cell disease, people with Down syndrome, various other things that I will have forgotten, but a relatively small group of people who are extremely vulnerable. So we've been offering vaccine to them as well. Then there's a next group down after the 65 to 70s, which we're doing at the moment. The next group down is a really big group. And this is the group of everybody else who would normally be offered a flu vaccine. So irrelevant of your age. So this is diabetes, lung disease, that's where carers come in as well. So if you're a carer of somebody who is elderly and disabled, then you will come in there. So there's about to be a very big group there, and we're working down in that order because that's making sure that people who are at most risk are being vaccinated first. And so that might well feel, while you can't get a vaccine, it's because of this very strict order. So sorry to jump in on that, Paulette, but I thought that might be...
No, I think that's a really important point to have brought out. Okay.
So Heartlands Hospital, I will talk about. So Heartlands Hospital was set up primarily for the staff, because we needed to vaccinate, as we say, all our health and social care workers quickly. And we set up hubs around the cities in the hospitals to try and get as many people vaccinated as possible. There were some members of the public who went there, but it wasn't really a terribly suitable place, because Heartlands Hospital obviously is very busy at the moment, and it was in the middle bit of the hospital. So at the moment we've vaccinated staff there, but we're resting it until the staff come round for their second doses, somewhere later next month. So, and we're providing access to the public in far more other places out with general practice. So as Riz says, we've got 27 at least GP sites across Birmingham and Solihull, and we've got Millennium Point and Aston Villa open as well, which are very big sites. So at the moment we're not using the hospital hubs for anyone other than health and social care workers.
Okay, thanks for that, Dr. Day. Can we move straight to Dr. Ingham?
Yes, I think the question was from Glenn. Glenn, I'm sorry to hear you contracted COVID 5 days after the first dose. The point to make here is that the vaccine doesn't give you full protection until 2 weeks after your dose. So unfortunately, you are still susceptible at that point in time. There is no need, however, for you to restart your COVID course and have the first dose again. We would just vaccinate you with the second dose when that comes up at the appropriate interval, which is currently 11 to 12 weeks.
Fantastic. Straight over to Dr. Varney, please. Your question.
Yeah, so my question was around engagement. How can people get more engaged and find out what's going on? So the council is working with the NHS locally, and the best way is to sign up as a COVID community champion, and we send information to the champions every week. We do question and answer sessions like this with the champions, and we've been doing special sessions on vaccination to give the champions the most accurate and up-to-date information for them to share with their friends and family. And I'll put the link in the chat on how you can sign up.
Fantastic. Gemma?
Okay, thank you.
Right, then the next 4 questions, please.
Okie dokie. So Councillor Mahmood's back. He wants to know if we have a breakdown of the number of vaccinations per ethnic group in the city, please.
Right, now that question, Clark, Dr. Day, are you able to, I know that answer can't be got, and unfortunately I know that Councillor Mahmood also knows we haven't got that answer, but just to humour him, because he's on the call and he's very willing, I'm going to ask Dr. Day to tell him the obvious, which I know he already knows. Councillor Mahmood. So Clark, Dr. Day, I'm going to give you, if you could answer that question. Second question, please.
Carmel would just like to clarify how many people have had the first dose and how many are now fully vaccinated. She just wants some clarity over the figures.
Right. Dr. Riz, are you the best person to ask, or should I go back to Dr. Day? Okay, fantastic. Can we go to the third question, please?
Yeah, Beatrice, again, she'd like to know how young people with a disability and wheelchair users will access a vaccination, please.
Dr. Ingham, please. And the fourth?
The fourth question from Steve, can he ask, please, you know, he's concerned about wasting vaccination and what the process is to ensure that we're not wasting it in Birmingham.
Dr. Varney, are you okay answering that, or do you want me to hand that to Dr. Day?
I think Dr. Day or Dr. Ingham are probably best placed on that one.
Okay, Dr. Day, can I hand that one to you also? Okay, Right, can we start with Dr. Day? The breakdown of the figures for wards with ethnic minorities and wasting of vaccines, please, Dr. Day. So question 1 and 4. Thank you. You're on mute, Dr. Day.
So as Councillor Hamilton has said, unfortunately, we're unable to exactly break down by ethnic group who has had the vaccine and who hasn't. We're getting better at that. So, and the problem with that was that right at the beginning, when we started this, we had a new IT system in the NHS, which is never that smooth. And that new IT system in the NHS has been okay, actually, as NHS systems go. But when we first started vaccinating, it didn't ask us, it didn't have a place for us to record someone's ethnic group within it. It does now. So as we're beginning to go through, we are beginning to collect that. And so over the next few weeks, we should be able to have more information. What we do know, as Riz and Dr. Varney have said, that unfortunately in areas of increased ethnic diversity, the vaccine uptake is lower in our city. And we've talked about that already. And that's one of the reasons why we're out here trying to talk to people, to encourage people around taking the vaccine. The question around waste, again, has been something that has been hugely in the news, as you say, and Riz explained to you that the Pfizer vaccine is one that when it comes out the deep freeze, which it has to stay in, it's delivered to the GP's site, and then you have to use it up in 3 days, 3.5 days. But what we've done, and the sites have been absolutely amazing with this, is that we have a real thing about this is like really precious drug, and it's completely against for a doctor to waste a drop of this because we know how precious it is. So people are booked in, and then if it gets towards the end of the day and the doctors doing the vaccine don't think that they've got enough people booked, they are ringing people up to come in and get it. And originally when we were doing it and we had the Pfizer, we'd call in healthcare workers to come and have it. And now we've vaccinated that. I've heard people of coming up the street in their pajamas to have the vaccine just because it's getting to the end of the day and people are very keen to have it. We've got less Pfizer around now, actually, and we've got AstraZeneca, and that's a much easier drug to use in this way. It's a vaccine that's easier to use because you can keep it in the fridge and you can keep it there for 6 months. You have to take it out and use a vial, and then there's either 8 or 10 doses in that, but that's much, much easier to plan. But wastage is something that we just, it's completely against all of our principles in this programme, and it really has not been something that has been happening despite the fact that it's been talked about.
Right, and thank you for that, Dr. Day. And Dr. Raz, can you answer your question, please?
Yes, so you wanted some specific updates about the first and second doses. So the information I have is accurate as of the 11th of February, and these are for cohorts 1 to 4, so that is up to the age of 70 and above. And this includes care homes and includes healthcare workers. So the total number of vaccination being given in approximate figures is 211,000, of which 11,000 only were second doses. So over 200,000 doses have been given for the first dose as of now, and 11,000 second doses.
Fantastic, thank you. I think Dr. Day did give a more accurate figure. I think she said something like 214,000.
Yeah,
243,000.
Yeah, I thought I heard a higher number. So we're rattling along. We're getting those vaccines done. Yeah. So good work. And the last question, Dr. Ingham.
Yes, okay. It was Beatrice asked, and she was asking about access to vaccines for young people with disability. So young individuals over the age of 16, those with learning disabilities or other physical disabilities, in particular those at risk, in at-risk groups where they normally would receive a flu jab, will fit into cohort 6, which Clara described just recently. That The vaccination of cohort 6 will be coming very shortly, just following behind 5. And as I said, this is a large cohort, but we will be moving towards vaccinating in this area very soon.
Please, can everyone ensure that their camera and they are muted, please? The camera's off and they're muted. Thank you.
Thanks, Gemma. Gemma, can we have another 4 questions, please?
Paulette, there aren't any more live questions to answer because Dr. Varney's been answering them in the chat, actually.
Right.
So there aren't any outstanding questions that haven't been answered by
Well,
Dr. Varney.
what I'm going to do, I'm going to ask a few of the simple ones that some of them I know Dr. Varney has answered, but he's been so thorough, so good. I'm just wondering whether or not. Well, the first question I'm going to give to the panel is, can you take the vaccine if you have had COVID-19? So you've already had COVID-19, and I'm going to give that question to Peter, question 1. The second one that I get asked an awful lot, and Dr. Varney did answer that question, but it would be good to get that in a little bit more detail. Many of the women that I know between the ages of 20 and 39, they are really, really nervous to take the vaccine because they're worried that it will affect their fertility. So could I ask Dr. Varney to just explain a little bit more about why it will not affect their fertility, or it will, just for clarity? The second, that's the second question for Dr. Varney. Have you got that, Dr. Varney? Have I lost him?
I've got it.
Okay, great stuff. And the third one, why should I get vaccinated if I'm not in an at-risk group? And that question is for Dr. Riz. 3, 1. Sorry, I'm doing it on the oops. So let me do those questions first. Let me start with Dr. Ingham. I think I gave the first question to. Peter, you've got your mute button on.
Sorry, I turned myself off. Yes, Paulette, if somebody has COVID or had COVID and was positive, yes, they can have the vaccine following that, but we would ask them to have the vaccine some 28 days after COVID, just so that we know that they've fully recovered from COVID before we vaccinate. But yes, they can have the vaccine. It's perfectly safe so to do.
Right. And the second question, Dr. Riz, the question about the at-risk group.
So I think if we were to look at COVID as a disease, and I think we'll find the answers there, as to if you're not at the at-risk group, so you are lucky enough to be young and not to have any chronic illnesses. The problem is, particularly in my patch of the city where I come from in the east of Birmingham, we all live in multi-generational homes. So you as an individual may be okay, but then your dad who is in his 50s may struggle a little bit if they were to get COVID. And then your grandparents who are probably in their 80s will definitely end up having complications if you end up transmitting COVID to them. So the simple answer to this is that yes, if you're not at risk in an at-risk group, you should still be vaccinated. And that is because if you look at the risk factors, people from ethnic minorities are already at risk. Then if you add in the spectrum of chronic disease, if you have any, then that's a problem. And then age becomes another issue. So depending on where you are on that scale, you're already at risk as a baseline to start off with. The second thing is that our intensive cares are full of people who are unwell, but a few of them have been those with no risk factors, and they've still become unwell. So COVID, in that sense, is quite unpredictable as to who is going to get unwell and who's going to come up with minor ailments and get through with that in that respect. So obviously 3 points. You're not completely out of risk if you don't have any risk factors. There's a transmission issue, and there's an age issue and risk factors issue that you have to take into account. I hope that's clear.
That is very clear, very clear. Dr. Varney, can I ask you to answer the third question about fertility, because that is a question that unfortunately I get asked quite a bit.
Yeah, so well, firstly, it's important to say there's no evidence that any vaccines affect fertility. And that's because basically vaccines work by introducing a bit of an organism into our body to teach our body how to respond to it. So it's got nothing to do with your reproductive organs. The introduction of the instructions to make the protein are a one-time recipe. And the cells that make the proteins don't pass that recipe on to their babies, in effect, their reproduced cells. So it's not like your body learns to make these protein spikes forever. It only learns while the vaccine's there. And once it's gone away, it's forgotten, but it remembers how to make the antibodies. So I'm afraid it's fake news, but I do want to also just point out, we have a horrid suspicion that this fake news is being spread by extremists because they know it's going to scare people and it's going to scare them, and that will put them at more risk of catching the disease. So there's no evidence. The Royal College of Obstetricians, the midwives have all come out and said this is rubbish. But it's also, there's quite a nasty side to this rumour, that it's people trying to mess with your mind and play on fears that link to different types of medicines, which are drugs that do affect pregnancy, like thalidomide. Very, very different drug, works in a completely different way. There is no evidence of vaccine causing any problems for fertility or pregnancy. And the way the vaccines we're using have been used before for several years. Even the Pfizer one, which is a new technology, has still been around for a few years now. So we have tried these methods before, and it is fake news.
Fantastic, Dr. Varney. Gemma, have we got any more questions, or do you want me to ask a few more of my idiot, I call them idiot questions that everybody does know, but I always think it's good to bring them in?
Absolutely. We've just got one more that's come in the chat. This person would like to know if the statement that people from BAME communities are more likely to have serious complications compared to the general population is evidence-based.
Right, that is a really good question. Can I ask the doctors who would like to answer that question? Because I think you're all pretty good with that one. But Dr. Riz, would you like to answer that one? Yeah? Do you want that read out again, or are you okay?
I'm okay, thank you.
Okay, and secondly, the one that I want to ask, why is the vaccine being rolled out before we know its long-term effects? And that is a Dr. Ingham question, please. So Dr. Raz, the first one.
Thank you, Councillor. So I think we have gotten to know COVID fairly well now. And I think based on what we know about COVID, there are 4 things that are going to make you more likely suffer from complications of COVID or more serious effects of COVID. And those are, 1, if you're a man, men tend to fare much worse compared to women with sort of complications of COVID. Age, so you're likely to suffer from complications of COVID the older you are, and that is why the vaccination prioritization group has been set in order of age, because death and serious illness is more prevalent in those over 80, and then those over 65 and over 70 and above, and that's that. If you have chronic ailments like diabetes, like heart problems, like breathing problems, you're more likely to suffer from complications because you're not starting at a physiological baseline, which would be that of a healthy sort of organ system. And we have found that a lot of the people who have died and suffered complications have been from ethnic minorities. Now, that is not quite well understood as to why that is. There are several theories regarding vitamin D and all sorts of things. unfortunately, vitamin D, or fortunately rather, vitamin D has been made to be the panacea of all illnesses, including my baldness, which is coming. But I think the evidence is out there. But unfortunately, these are the four things that would increase your risk of suffering serious complications. Now, it doesn't mean that if you're within these groups that you will suffer from these consequences. It just means that it puts you more at risk and you're more likely to compare to somebody from the general population.
Thank you for that. And Dr. Ingham, I'm going to ask you to answer the second question.
Thank you, Paulette. So regarding long-term effects from the vaccine and the vaccine program. So the vaccines have been extensively trialled with large numbers of individuals over many months. The serious effects that one might see arising from a vaccine would normally happen early on in the testing period. We haven't seen evidence that that has happened. It's true to say that we can't test for long-term issues in any new vaccine that we introduce to a population. It's not just COVID, it's any new vaccine. We've always got that issue. And ideally, we would like to test for longer and longer, but actually, practically, we don't have the luxury of doing that. We want to move on and vaccinate our population. We do believe the vaccine is safe. All of the trials have not shown any significant major issues that we have any concerns about. It seems to be safe as our flu vaccination campaign has been, and actually much more effective. Thank you.
Right, that is fantastic. Right, now I'm going to ask another few of the really simple ones, but I think...
Just to let you know that Mike has got his hand up and would like to ask a verbal question if you're happy for that to happen.
Oh, I am happy for that to happen. It'll stop me asking questions. Right, Mike, can you put your camera on and ask your question? Can I please say, if the question is to rebut what we're trying to do, please don't start, because I am going to ask Gemma to mute if that's the case. I've got to say it because of what happened at another meeting I chaired. So Mike, over to you. Thank you.
Hello, can you hear me?
I can hear you, Mike.
Fantastic. Hello, thank you for putting this interesting program on. So yesterday I heard the government included, together with some other people, making lots of references to the World Health Organization having approved AstraZeneca and everybody should be vaccinated with it. What about Pfizer? I've already had a Pfizer. My first jab was a Pfizer one. So has that not been approved by the World Health Organization? And what difference does it make? That's basically my question. Thank you.
That's a really good, and I'm going to give that one to just Dr. Varney. And on the back of that, Mike, I'm going to ask the question, why can't vaccination I get? And that's for Dr. Ingham. And the third question, is there any plans to mix the vaccines? And that's for Dr. Day.
Fantastic.
That's all in the same area. Okay.
That's brilliant. Thank you.
Okay. So, Dr. Varney, can we start with you with the verbal question?
Yeah. So at the moment, the Pfizer vaccine is being used, and we're aiming to give people the same dose each time. And the reason they made more public statements about the AstraZeneca is in some countries like Germany, they decided not to give AstraZeneca to older people because their regulator felt that there wasn't enough evidence. Now, our regulator felt there was enough evidence, and the WHO have said they think there is enough evidence. So I expect Germany, and I think it was France, will be changing their approach to AstraZeneca. But the Pfizer one's not commented on because no one had an argument about the age groups. So that's why it hasn't been in the press.
Okay, thanks very much, Doctor, for that. Thanks.
Thank you. Could we ask Dr. Ingham to answer the next question? Why can't I choose which vaccine I get?
National experts have worked hard at analysing the data and believe that both vaccines offer excellent cover and protection to all ages. The programme itself is being nationally governed and nationally run, and it has been made very clear to us that patient choice of vaccine is not available within the programme.
Right, fantastic. That's simple but clear. And the third question, Dr. Day, is there any plans to mix the vaccines?
So no, not at the moment. As Dr. Varney said, the trials have been done with the same type, and it's stimulating your immune system once, as we says, to make you competent and then an expert with the same vaccine. So the plans at the moment are to use the same vaccine to as your first and your second dose. However, they are now starting to do some trials as to whether vaccinating you first with one and second with another gives you protection, because that's a really important question, because as we've said, some of these vaccines are quite tricky to look after and to have in to use, and some of them are easier to use, and it may well be, depending on the results of those trials going forward, that things change. But at the moment, the policy in this country is to have 2 doses of the same.
Okay, that's fantastic, Dr. Day. Can we go back to Gemma? I've seen a few questions pop into the box.
Yep.
Gemma, over to you.
So another question from Tarek. He wants to know why the Green Book states 3 weeks for some groups to have their second dose, and why haven't they had it yet? I think Dr. Varney's just answered that one, so that's fine. Steve has said, as the South African strain has been identified close to Birmingham, should we be worried about it?
That question is going to actually be for Dr. Varney, because we've talked more about the South African strain than anything else in the last couple of weeks. So, Dr. Varney, that eagle question, the eagle, that's what they're calling it, the South African strain, that will be your question. Another question that I get a lot of is, how comes vaccines with less than 90% effectiveness are approved? And I'm going to ask Dr. Raz, are you able to answer that one? Is it me?
Yes, that's fine. Thank you.
Okay, Doctor. Are there any more in the box, Gemma?
No, that's it for now. Thanks, Paulette.
Right. Now, a question that was asked of me quite a lot at the beginning was, and I'm going to ask Dr. Ingham, a lot of people in my community kept saying, well, if they've given me the flu vaccine, does it mean that if I test for COVID-19, it will be positive? So, Dr. Ingham, I'm going to ask you that question. If I've had the flu vaccine, can I test positive for the COVID vaccine? And I've completely lost my train. Who did I give the first question to? Was it Dr. Day or was it Justin? Justin, the South African one. Yeah, Justin.
Yeah. So we have a small number of cases of the South African variant in the south of the city, which are not connected to someone getting off a plane from South Africa. So we're doing additional testing to try and work out where it might have come from. The South African variant is like the Kent variant in that it's more infectious, but we don't think it is more deadly. There is some evidence that the AstraZeneca vaccine is not as good against the South African variant, but it does still work. And most importantly, it is as good at preventing death or hospitalization. So we should be nervous, but not worried at the moment.
Thank you, Dr. Varney. Can I go straight over to Dr. Raz?
Yes, thank you. So we were wondering why, if a vaccine is efficacious for 90 or 95%, that it would get approval. So I think first thing to note is that no vaccine is 100% effective. That does not exist, that cannot exist, because we are vaccinating against viruses who keep changing all the time, and therefore some bit of the virus, if that changes to what the spike protein that your immune system is learning to fight against, then it would probably not be as effective, and therefore the efficacy would drop. And that, hence the argument about the AstraZeneca vaccine and how effective it is over the last few days in the media with the South African strain, that argument has come about. 95% is actually pretty good. In that what it means that if we were to vaccinate 100 people, 95 of those would probably either get a very mild form of the illness or not get the illness at all. Now, that to me is actually very good odds. The AstraZeneca vaccine is about 70 to 75%, and that is also good odds as well, because that protects over 3/4 of those people who have the vaccine. The efficacy of other vaccinations that we use, for instance, like flu, where we have different strains every year and we predict them, is around 30 to 35%. So I think in comparison, the vaccines on offer are much, much more efficacious and much, much more protective.
Thank you for that. Thank you for that full answer. And we're going to go over to Dr. Peter Ingham regarding the question I asked about the flu vaccine and testing positive.
So I think you're saying, so if you've had a flu vaccine, you're worried that you then may test positive for COVID.
Yeah.
I don't believe there's any evidence for that would be the case. I wonder if there's some confusion about the COVID vaccine and flu vaccination.
There is also, but I didn't want to do too much at once. There is, because people also.
Well, I don't think there's any evidence of any connection between the flu vaccine and a positive COVID test.
Okay, thank you for that. Gemma, are there any more questions? I know that Tariq has been asking quite a lot of questions in the chat box. Is there anything you'd like to read out that might help others who perhaps can't see the information in the chat box?
I think it was around dosing for immunocompromised individuals. Apologies, I just need to.
Gemma, shall I just read that question?
Yeah, go on then, Justin.
Yeah, so Tarek was just asking for clarity about whether the 12-week wait between the two doses and the impact. And we know that decision was made because we have a limited amount of vaccine, and from the first dose, it stops you dying or ending up in hospital, and it gives you some protection against infection. And the second dose strengthens the protection against infection. And we now know that that protection doesn't really decline much over the 12 weeks. For patients that are immunocompromised, the Green Book's been updated, and that's the book that says how you give medicines. That's what Tarek's talking about. And people who are immunocompromised, we don't need to do their second dose any faster. But if we're planning to give them medicine that will impact on their immune system, then we should try and vaccinate them before they start that treatment. So the Green Book advice about vaccination for people who have immune systems that are lower is more about people where that's due to drugs rather than due to disease. And so there's not any special schedule for them at the moment. And I don't know if Clara wants to add in, because this is more your specialist area than mine.
Clara, Dr. Day?
So yes, as Justin says, the Green Book is the source of all the information about vaccine, and it changes from time to time, and it has changed over since it was first published at the end of November, and there was a change. I can tell you exactly when it was, the 26th of January, because that's how dull I am at the moment and know when these things happen. But so that happened at that stage, and that was changing the information, as Justin says, for people who've got a relatively normal immune system and were about to really bash it down. But they also have to have long enough for the 2 doses of vaccines to work, and that's, so you know, is either 3 or 4 weeks between the vaccines, depending on it. And then we say at least 2 weeks after that second dose for your body to be properly responding to it. So if you're about to have your immune system suppressed and you've got time to have the 2 vaccines and at least 2 weeks afterwards, then we would consider recommending 2 doses. And for people that, so I'm just doing this at the moment for the hospital and that, and for people in the community. And for instance, it's people who are on a waiting list for a transplant, because we have to suppress immune systems all the way down. So whether that be a kidney or a liver or something, or also if you're due to have a bone marrow transplant, then we would do that. And also for some people who've got conditions where we're going to suppress the immune system, but we don't need to do it really quickly. So some people have MS and multiple sclerosis, the treatments with that now, we're recommending it. And for some people who have inflammatory conditions such as lupus and some things like that, where again we plan to suppress the immune system. So it's for a very small group of people at the moment. And it may well change, because as I say, they change the Green Book all the time, but that's what it is at the moment. And what I will be doing is ensuring that people for whom that applies, their hospital specialist sends them a letter to say that that applies for them, and then that will help them get those vaccines like that.
That is excellent, excellent, Dr. Day. I tell you, we've got one question. The question, I don't know if Gemma can ask it, but I can.
I'm back.
Are you back?
Yeah.
Because what I want to also do, Beatrice has said, the citizens want a better communication and understanding around vaccine. That will be, I'm going to ask if she can be brought in to actually give us some suggestions of perhaps what she feels we're not doing. So could you just give me the last questions, because this will be the last round, and then we'll bring Beatrice in. Thank you.
Okay, so the last question is from Steve. Are there any plans to use the main NHS app to notify and assign COVID vaccination appointments, and for any ongoing notification?
That would be a Dr. Day question. Dr. Day, can I ask you to answer that question? Then we're going to bring Beatrice in.
So no, there aren't any plans to use the NHS app at the moment. There's NHS IT, again, is one of those things we always have a little bit of a smile on our face with. But there's a national booking system which is used for the big sites, so for Millennium Point and for Aston Villa. And when you get to the point that you are in one of these cohorts that you are eligible for, you get sent a letter, and that allows you to log in and do it. And actually at some points we're then, if we're going outside of people who are getting letters, we might text you from either the general public or from your doctor to say you can log in through that system. So there's a national booking system for the big sites. The GP sites at the moment are using their standard ways of calling people in and out for appointments, and that depends on the systems that they have in their surgeries. So some of them are having to call people, and some of them are able to text out, and some of them have systems that do allow them to text out and to press a link and book, but it's very variable at the moment. We're trying to get it smoother across the city, but combining the use of IT across many GP sites is actually quite complicated.
That is fantastic. Dr. Varney has just put something in that I think I want to read out. The NHS will never ask you for your credit card details, your bank account details, or anything like that. And they will never ask you to pay for the vaccines, and emails will always come from NHS Net. Yeah, so I think that's really important. Now, before we finish, Beatrice, is Beatrice able to come and just And Gemma, are we able to bring Beatrice through, or does she not want to speak?
Well, I sent Beatrice a private message asking if she's okay with asking the question, but she's not replied to me yet, so I don't want
Not
to.
replied.
Yeah.
Okay, well, I won't force her, but I just thought it was a good point, because what I'll do is I will give Dr. Raz, Clara, and Justin, and Dr. Ingham 30 seconds to tell us what they've been doing to actually communicate to the public how to get vaccines, how to get tested, to ensure. Now, Justin did a lot of that at the beginning, but let me start with Dr. Ingham. Would you like to give a few ideas of what we've been doing in the NHS and primary care?
So practices right across the city have been incredibly busy communicating with patients and working it, through the cohorts that Clara described. So we've worked through those at-risk individuals initially, texting, phoning, trying to contact in any way we can to make sure that people come forward for their vaccines. We've also been working to vaccinate in care homes, and our community trust and GPs have been working to vaccinate patients who are housebound and unable to attend so that they can have their vaccines. We have been working right across the city with faith communities, and our GPs and our BAME champions at the CCG have been working alongside the COVID champions, Justin's team of COVID champions, to try and improve engagement in that area. And Riz has commented on that area already, so I won't take that any further. But there's been huge engagement to try and get everybody vaccinated.
And Justin, have you got anything you want to add?
I think the other thing to say is we work really closely with faith communities in the city. So I meet every week with faith leaders to talk about this, and the CCG have brought GPs like Dr. Rizwan have joined me for some of those sessions to answer their questions as well. And we also commission 19 community organisations working with 35 different targeted community groups to help get messages out. And of course, the COVID champions. And if you're not a COVID champion yet, please go on the council website and sign up, because it's a great way of getting facts straight into your hands to give to your family and to your friends and the people you really care about.
Fantastic. Dr. Day, any final comments from yourself?
So one of the things we are doing is lots and lots of sessions like this, and have been doing them for several months now with anybody who will have us to come and talk about the vaccine. So we're doing an awful lot of talking like this. I know Gemma, who's on the call, is leading the communications programme with another group across the city, and I know they've done absolutely loads of stuff, including they've got videos online of people talking about vaccine in all sorts of different languages. She's had leaflets translated into all different languages. They're about to have some posters up around the city. We've got a website with lots and lots of information on, and every time that we get asked a set of questions, we update that, and we update that as that happens. So we're trying very, very hard to get information out, but hopefully with us having talked to you tonight is that I'd really just plead with you to listen what you've done tonight and go and talk to your friends about it as well, and give them information that we've given to you this evening as well, so that we can try and get as many people protected in the city as we can.
Can I just butt in before I bring Dr. Raz and we finish? Bev Clark, she's highlighted stuff around local radio, TV, live adverts, and people who will watch and engage. Trust me, that is going on also. And can I also say to you, Bev, doctors are now doing house calls. They are ringing people individually. They are meeting them at the place they're at and asking them the questions why. And doctors have also been campaigning to ensure that when they go into the houses, that if they're in multi-generational households, that they can be allowed to vaccinate everybody. They have been trying everything. I I can assure you, to get to people in the places where they live. Now, Raz, you're going to have the last word. If we've missed anything, please add it now before I just close.
Thank you very much, Councillor. I think most of the things that is being done has been said, but I would like to take this opportunity to reassure that we are constantly looking at the provision of the COVID vaccination across the city, taking specifics into account. Just for instance, one of the things that is on my radar at the moment is the upcoming month of Ramadan, and that Muslims cannot have vaccinations when they're fasting. So how can we work around that and be able to still provide a vaccination service during this month? So it's something that we are now looking into and trying to work around to see how we do. But on a more granular basis, your GP is always available to answer any questions that you may have, and please do not hesitate to call. And I think what I'm encouraging all my GP practices to do is to make calls themselves rather than administrators calling, because it is better that a request comes from a trusted source, and therefore there's a better chance of that message being accepted. And finally, what I would like to remind everybody else on the call now is that we have done what we can, and we will keep on doing what we can, but it is their turn now. So the first thing I'd like to say is that when you get your invitation, please have the vaccination. The second thing is that if you're not going to have the vaccination, that is absolutely fine. That's a choice that is accepted. But do not spread anti-vaccine messages across, because it takes 7 positive messages to counteract 1 negative one. And if you must share, then please do the research and make sure that it is an authentic message with some evidence back to it, not just what we have a scourge in modern life at the moment of sent as received, because that's not unhelpful, and we would be responsible if that person didn't take the vaccine and hence suffer the complications and consequences of COVID-19. Thank you very much.
Thank you. And on that note, we're over time. So I'd like to thank Dr. Day, Dr. Varney, Dr. Ingham, Dr. Raz, and our 2 interpreters. I can't find their name, but I'd also like to give a big thank you. I've got it now, to Rachel, to Stephanie, and also to Gemma, who has been a star this evening, and Kolvinda in the background, who without her, she's helped to put tonight together. But more than anything, can I give a big thank you to everybody that's taken the time to not just log on tonight, but ask the questions. And without you, this couldn't have happened. So thank you and good night. And we hope to see you or tell people about the next one that we're doing, that it's a central one, but you're all welcome. And any questions, please forward them. We'll ensure we answer as many as we can. Good night all. Thank you. Right. Gemma, again, thank you. I'm going to off. Okay. Good night, all. And thanks again, everybody.
Thanks, Rachel. Thanks, Stephanie. Much appreciated. Thanks, Riz.
Thank you. Good night.
Take care. Bye.